of the patient?
Short of the female.
Her age?
10.
Birth date?
February 22, 2010.
May I know your address?
Barota Level.
May I know your religion?
Roman Catholic.
So ma'am, may I know the reason for seeking care?
For monthly checkup.
Do you have any present or health history of present illness?
None.
Does your child suffer from measles,
No.
mumps,
None.
chickenpox,
No.
or ear infections?
No.
Your child suffer from any serious accidents or injuries?
None.
Your child has a serious or chronic illness?
No.
Do your child have any history of operations or hospitalizations? What are her previous immunizations?
After birthdays, Hep B, rotavirus, diphtheria, tetanus, flu, and measles.
Does your child have any allergies?
No.
Do you have a family history of heart disease,
No.
high blood pressure,
None.
diabetes, blood disorder,
None.
arthritis,
None.
cancer,
No.
allergies,
None.
learning disabilities, birth defects? So that's all for today, ma'am. Thank you, and I'm done taking your health history.
Thank you.
Check physician's order or nursing care plan for frequency and route of temperature measurement. Review medical records for baseline factors that may influence vital signs.
Wash hands using the proper technique. Gather equipments and supplies. The hypo tray contains digital thermometer, alcohol swabs, or container with cotton balls with alcohol, container with dry cotton balls, tissue, waste receptacle, BP apparatus, and stethoscope.
Jot down notebook, black and red ball pen, and watch with second hand. I am now ready to go to my patient.
Greet and identify the client. Introduce self and explain procedures to be done and assess client's ability to assist in the procedure. Ensure adequate lighting and minimize the noise in the room. Assist the client to a position of comfort and provide privacy. Wipe the thermometer with an alcohol swab or cotton balls with alcohol from the probe to the stem. Press the on and off button to start power. Expose the client's axilla and pat dry. Place the thermometer probe in the center of the axilla and place the client's forearm across her abdomen. Leave the thermometer in place. Place lightly 2 or 3 middle fingertips over the radial pulse site. Using a watch with second hand, count the number of pulsations for 1 full minute. While the fingers are still in place, after counting the pulse rate, observe 1 respiratory cycle. Count respiration for 1 full minute. Remove the thermometer and wipe with dry cotton balls from stem to probe. Read the temperature seen from the LCD display. Properly disinfect the thermometer and return to the container. Record the temperature, pulse, and respiration. Check if the diaphragm in the bell is open and functioning. Clean the diaphragm and earpieces of the stethoscope with an alcohol swab or cotton ball with alcohol. Select appropriate arm for application of appropriate cuff size. Position the forearm supported at the level of the heart and with palm facing upward. Expose the brachial pulse site by removing any constrictive clothing. Place the bladder of fully deflated cuff over the artery by positioning lower edge cuff about 2.5 centimeters above the antecubital space. Wrap the cuff around the upper arm smoothly, snugly, and fasten it. Check the needle of the aneroid gauge if it is within 0 mark. Perform preliminary palpatory determination of systolic pressure. Close the valve. Proceed in taking the blood pressure of your patient. Record the blood pressure reading. Place the client in a comfortable position and gather vital signs, apparatus, and equipment, and dispose used cotton balls and other materials, observing proper waste disposal. Wash hands. Evaluate vital signs measurement using the following criteria, within normal limits and factors present which might affect the TPR and the blood pressure. Report any abnormal findings to the appropriate authority. Assemble and gather equipment. Greet and identify the client. Explain the procedure to be done and the reason and how the client can cooperate. Ask permission to close the curtains and turn on additional lights. Assess for the general appearance, facial expression, body build, and check the height and weight, relation to age, or developmental stage. Assess the client's posture, hygiene, grooming, body and breath odor, signs of distress, and apply gloves if necessary. Inspect and palpate the head for size, shape, and configuration. Note the consistency, distribution, and color of hair. Observe the face for symmetry, facial features, expressions, and skin condition. Palpate the temporal arteries for elasticity and tenderness. As the client opens and closes the mouth, palpate the temporomandibular joint for tenderness, swelling, and crepitation. Test visual acuity. Ask the client to read the smallest possible line of letters, first with both eyes open, and then one eye at a time. Inspect the external eye structure. Examine the pupils for quality of size, shape, reaction to light by darkening the room and using a pen light to shine the lights on each pupils. Inspect the ear bilaterally and palpate the ear and the mastoid process for tenderness. Inspect the external nose for color, shape, and consistency. Palpate the external nose for tenderness. Check patency of the airflow through the nostrils. Perform hand hygiene and put on gloves. Inspect the teeth for number and condition. Check the gums and the buccal mucosa for color, consistency, and lesions. Inspect the hard and soft palate for color and integrity by asking the client to open the mouth wide using a tongue blade and a pen light. Observe the rise of the uvula. Inspect the tonsils for color, size, and exudates. Inspect the tongue for color, moisture, size, and texture. Inspect the frenulum and the Wharton's duct. Palpate the tongue for masses and tenderness. Inspect the neck for lesions, masses, and swelling. Test the range of motion of the neck. Palpate the lymph nodes in a slow and circular motion. Palpate the trachea for alignment and deviation. Inspect the thyroid gland for visible enlargement and masses. Inspect and palpate carotid arteries. And auscultate for bruit. Inspect the upper extremities for all over skin coloration, texture, moisture, masses, and lesions. Palpate shoulders and arms for tenderness, swelling, and temperature. Assess the epitrocular lymph nodes. Test the range of motion of shoulders and elbows. Palpate the brachial, ulnar, and radial pulses. Inspect the palms of the hands and palpate for temperature. Check for capillary refill. Test the range of motion of the wrist. And test rapid alternating movements of the hands. Inspect the shape of thorax and respiratory effort. Auscultate for breath sounds and adventitious sounds. Auscultate for the heart sounds. Assessment of the abdomen. First is you need to inspect the shape. Also inspect the umbilicus and auscultate for bowel sounds. Inspect the lower extremities for overall skin coloration, texture, moisture, masses, lesions, and varicosities. Also note the hair distribution. Palpate for the pulses, the femoral, popliteal, posterior tibial, and the dorsalis pedis. Palpate for edema, skin temperature, muscle size, and the tone of the legs and the feet. Palpate the joint of hips, knees, and ankles. Test the range of motion of hips, knees, and ankles. And assess for capillary refill. Assist the client to a comfortable position.